Women with underlying heart conditions face increased risks during pregnancy. Not only is heart disease the #1 killer of women, it's the #1 killer of women in pregnancy as well. Thanks for joining us for this week's Health News You Can Use. I'm Lindsay Stish. As we wrap up Heart Month, we're talking about how heart disease can affect pregnancy, how pregnancy impacts the heart, complications that can occur during pregnancy, and how St. Luke's is helping women with heart disease have healthy deliveries and babies. With me today is Dr. Laura Schmidt, a cardiologist with St. Luke's Mid-America Heart Institute, and Dr. Karen Florio, a maternal fetal medicine specialist at St. Luke's and the chair for Missouri's Maternal Mortality Board. Thank you both for joining us.
Thank you.
Thank you.
So, Dr. Schmidt, starting off, how does pregnancy affect a woman's heart or women with heart disease?
So a pregnancy is like a 9-month stress test. We will see that the heart rate increases by 20 beats per minute with a normal pregnancy, and the heart volume increases by about 50% with a normal pregnancy. So even somebody with a normal heart may feel some of the changes that affect the vascular system.
Okay. And Dr. Florio, how does heart disease impact mom and baby during pregnancy?
That's a really good question. So when I talk to my patients, I tend to frame it as how does heart disease affect your pregnancy and how does pregnancy affect your heart disease? So for instance, a person who gets pregnant and has a bioprosthetic valve, we know that that valve wears out a little bit quicker because of the pregnancy itself. And then you flip the coin and say, how does the pregnancy, how is it affected by heart disease itself? As Dr. Schmidt had pointed out, we know that it tends to put a lot of stress on the heart because of all the physiologic changes. And so patients may feel a little bit more tired, they may get a little more worn out, and they're at higher risk for adverse outcomes such as arrhythmias or heart failure. And then from the pregnancy standpoint, depending on the type of heart disease that you could have an increased risk for preterm birth or preeclampsia.
Okay. So Dr. Schmidt, what complications can happen during pregnancy in those with a heart condition?
It really depends on what the woman who is pregnant has going into pregnancy. But overall, we see a higher risk of problems like arrhythmias and heart failure for women that have underlying heart disease.
Now, Dr. Florio, what about pregnancy-related conditions that impact the heart?
That's a great question. So we tend to see a little bit higher risk of preterm birth, so women that deliver before 37 weeks. And again, as Dr. Schmidt had pointed out, that really depends on the type of heart disease that you have. So women with, let's say, palpitations or supraventricular tachycardia, their risk wouldn't necessarily be as high as somebody who has had a heart transplant. So it really depends on the type of heart disease that you have and therefore what type of risk for the baby and her during the pregnancy it would be.
So Dr. Schmidt, St. Luke's has a specialized program for women with known heart disease who are pregnant. Can you explain how that program works?
Sure. So in our integrated heart disease and pregnancy program, high-risk OB and cardiology sees the women who are pregnant at the same time. That way they can ask their questions all at once and everybody is on board. We can discuss the patient beforehand to give her an idea of what her risk might be with the pregnancy and what the treatment options are.
Okay. And Dr. Florio, when do you start following patients in the heart disease and pregnancy program?
So we've actually seen patients before they get pregnant, and we would encourage any woman who knows that she has heart disease to come see us in the preconception period. So we can lay out a really good plan for them during their pregnancy. And then once they become pregnant, we encourage them to call us with a positive pregnancy test so we can get them set up for their ultrasounds so that they can see cardiology and MFM again together. And we continue that process, again, depending on the type of heart disease that they have throughout the pregnancy. As Dr. Schmidt had mentioned, we're in constant communication, not only with each other, but with other services that we know are important to the patient's care, such as neonatology and anesthesiology. And again, that continues throughout the pregnancy. We will huddle, if you will, together to talk about patients. And then once we've delivered them, we again review what went right in our minds and what we could have improved on.
Okay, great. So lastly, Dr. Florio, what final message do you have for people watching today?
I think that it's really important to understand that heart disease touches us all. It is the number one killer, as we know, of women outside of pregnancy. And now through the work that we do at the Pregnancy Associated Mortality Board, we know that heart disease is the number one killer in pregnancy. And I think that's something that people don't realize. So I would encourage women who have known disease to contact their doctor right away once they're thinking about a pregnancy, also once they become pregnant, but also for women that don't know they have heart disease, it's important to contact your OBs right away if you have a strong family history, if you're experiencing symptoms, to get in and talk to your OB about what can be done.
Okay, great. And Dr. Schmidt, do you have anything to add?
I would also suggest that those women with underlying heart disease come talk to us early. A lot of people have been told they can't have a pregnancy, and we find that many women can, but we'd really like to discuss those risks and what they can expect during a pregnancy early.
Okay, great. Well, thank you both again for joining us.
Thank you.
Thank you.
To learn more about St. Luke's Heart Disease and Pregnancy Program, visit stlukeskc.org/heart disease and pregnancy. You can also stay up to date with all the latest developments on the COVID pandemic and other health news from St. Luke's at stlukeskc.org/news. Thanks again for watching. We'll see you next time on Health News You Can Use.